and you are catching us live and direct from the Hope Studios right here in Lusaka. We're broadcasting on many platforms, social platforms, Facebook, YouTube. We are also on Topstar. We are also on the Hope Decoder, and we are also on the free-to-air decoder. Now, there are many platforms that you would catch Hope Channel Zambia online and also on your television set. And Hope Live, like we did indicate in our preamble, we are just here to get interactive, discuss sticky issues in the nation, in the church, and everywhere, so that we get to move in one direction. And today, we are zeroing in on overcoming addiction. And we just want to see how we set ourselves on a journey to redemption, but that also includes recovery. Dr. Daniel, I'll say the other word, the other name, because I love it, Ngombo Kabani, is here with me on set. Doc, greatly honored to have you on the program, and I must mention that you have broken the record, because this is the first time we are doing Hope Live, and you are our first guest.
Wow. Thank you so much, my pastor. I'm very, very humbled and super excited to be here. And it's an honor
Indeed.
to actually be on the inaugural,
Hope Live.
Yes, Hope Live.
Yeah. Okay, so then I know we'll talk about a lot of things here, but I want to ask you a very personal question.
Okay.
Yeah.
Okay.
What is your addiction?
That's a good one. I think I have a couple of addictions.
Okay.
One of them is reading.
Reading.
Yes, reading. I think reading is an addiction to me. And other than reading, I would say that
I think at some point I had an addiction of social media.
At some point.
Yes, social
Not
media
anymore.
addiction. Not anymore.
Okay.
I had to come up with a strategy of how to break away from it. I reached a point where I would actually be Facebooking even while driving, which is very dangerous. Yes.
Now that one was an extreme.
Exactly. Yes. So I think these are the two that I can quickly pick.
So there is one negative and one positive.
Yes.
So is it safe to say there is positive as well as negative addiction?
Yes, yes. Though really the word addiction in itself carries a negative connotation, because addiction speaks to the fact that once somebody becomes addicted, that addiction disrupts their normal way of functionality. It means they can't now live and do things normally until they feed the addiction. The addiction will begin then to interfere with how they spend their finances. It will begin to interfere with their social relationships.
Right.
It will begin to affect their work. So ultimately, addiction is negative, even when it is an addiction in good things, because it will begin to affect other aspects of life.
That's interesting. And so there is no need for us to comfort ourselves and say, mine is a positive addiction. Ndiye bali na negative addiction. So
yes.
addiction is addiction, and there is nothing to celebrate, according to what I'm getting from Dr. Kabani in terms of addiction. So then, let's zero in on the types of addiction, really. What types of addictions can we classify addiction into different categories?
Yes, yes. So from a medical standpoint, when we normally talk for in health, literally when we talk about addiction, it often focuses more on substance abuse. Okay? However, from a psychological standpoint, addiction is quite broad, even within the medical sense. So from a medical standpoint, we talk of addiction as there's what we call physiological addiction. Okay. Physiological addiction involves body changes that make the body fail to function unless it is on that substance. Okay? That is physiological. So the body fails to function unless that substance is introduced. When the substance is not there, you see physiological symptoms. Now, maybe this word, what is physiology?
Yes.
Physiology is body functionality. Okay? When we talk about physiology, we talk about how you breathe. That is physiology. There's normal breathing there's abnormal breathing.
Right.
When we talk of physiology, we talk about your heart rate. There's the normal heart rate, there's abnormal heart rate. Okay? When we talk about physiology, how you sweat, there's normal sweating, abnormal sweating. So when we talk about physiological addiction, it means now you need that substance to maintain your body functionality. Immediately we remove the substance, we see abnormal functionality. For example, you begin to breathe abnormally, you begin to sweat abnormally, your heart begins to beat abnormally, you begin vomiting and things like that. So that is physiological addiction. Then we have psychological addiction. Okay, psychological addiction is actually where there is not literally physiological changes in the physical state of the body, but it has to do with the mind. So now is where you are addicted in that, you know, the mind is what gives us issues of how we feel. You feel high, you feel low, you feel what? So certain people get addicted that now they would want to be getting the feeling of being high. So you want to be on the substance so that you get the feeling. That is psychological addiction. There's even sociological addiction. This goes to an addiction where for you to function, you need a certain environment, a certain grouping of people. So you always want to find yourself within such spaces.
Yes.
So all these are different types of addiction, which later on may manifest in different vices. Sure.
Now, while I appreciate this information that you have given us, Doc, there is what I would say a time that you don't really realize that with what you are doing, you are actually in a phase or a moment of addiction, but you think it's normal. I'll pick on social media, for example. You said it was one of your addictions, but you agree with me that it's the addiction of many people in this time and era. Now, there are certain people, if I called you and told you now that, or if somebody called you and told you that Bright has died, God forbid, you wouldn't want to believe their word of mouth. The next thing you want to do is to scroll social platforms and verify if social media has that information, then it's confirmed. If it is not on social media, then you have every reason to doubt that. But one would think, well, that is leading me to probably some safer avenues, safer playground field, so to speak, and I shouldn't be worried about such. With the categories that you have given, physiological, sociology, and as well as psychological kind of addictions, from the three, would you say there is one that weighs a lot higher than others, or they are all graded the same?
Actually, funny enough, one would think that physiological addiction is the most strong, where the body is involved.
Yes.
But no. Medical research has often highlighted that psychological and sociological addictions are actually way stronger. Yes. And that is the funny thing. Probably that's why the Bible talks about girding up the loins of our mind.
Oh, yeah.
You know, Peter says, gird up the loin of your minds. Paul also talks about the mind in Romans chapter 12. He talks about be transformed by the renewing of your mind. And over, God speaks about taking care of your mind. It's because the mind runs everything. So it is actually easier to break away. I'll give you an example of one drug that does not cause physiological addiction, but causes psychological addiction. It's cannabis. Yes. So cannabis, unlike heroin, okay, if I put the two, heroin or cocaine causes physiological addiction. That is why when a person who is an addict of cocaine or heroin does not get the heroin or the cocaine, what happens is that they go in what is called withdrawal syndrome. Okay, withdrawal syndrome is where they present with very bad reactions, physiological reaction. They will have diarrhea, they will be vomiting, they will be shivering, they may begin to have what is called delirium, where you are having, these funny, mixed up thoughts and everything like that. That's a physiological addiction. It looks very strong. Okay, but cannabis produces a psychological addiction. even if you stopped smoking cannabis today, you will not go in a withdrawal syndrome, even if you are an addict. So you will not present with physiological symptoms of vomiting and shivering and what, because you have not smoked today. However, what you're going to miss is the feeling of being high, which is psychological. And that has been proven to be way stronger than actually the physiological addiction. So yes, the psychological addictions are very strong.
Very strong.
Yes.
So can one say I'm safer on those that are not strong?
Unfortunately, you know, there's an adage about addiction which says that the chains of addiction are too light to be felt until they are too strong to be broken. So too light to be felt until they are too strong to be broken. What that means is actually nobody can pinpoint to the day they became an addict. So normally, whether it is substance or it's social media or anything, it does not begin with addiction. It begins with use, then misuse, then addiction. So that is the stages of growth into addiction. You begin with use, then you go into misuse, then you go into addiction. So if it's social media, you begin with social media use, which is a good thing.
Yeah.
Then soon into social media misuse, then finally into addiction. Okay, of course for the drugs, I wouldn't talk about use should be avoided almost at all costs. Though we know, if I'm talking about use, is we know that some of these drugs that are misused or that people use for addiction, we use them also as good drugs in the hospital.
Okay.
I'll give an example of codeine. Okay, so codeine is a drug that we actually use in the hospital to treat cough. That's why you can find it in cough mixtures. It's a normal drug. We can use it to treat cough. So people begin with use. Somebody went and bought it and took it. And as they were taking it for their medicine, if they took an overdose, then they experienced a feeling of being high. Then they begin to misuse. Now they'll begin using it, not for cough, but so that they feel high. And in those initial stages, they are not addicted. If they want, they can quit. But the day they'll graduate into addiction, they will not know. There's no point you can say it is on the 3rd of April that I became an addict. So the strongest thing, therefore, or the best thing is to avoid at all costs if possible.
That's the best thing that we can do. I don't know about you. I'm on my way to recovery already. And just in case you are joining us, this is Hope Live, and today we are discussing overcoming addiction, a journey to redemption, and Dr. Kabani is with us in the studio. We've just laid the foundation of what we are discussing this afternoon. But you can participate by sending us a text message on 0976151517, and we'll be glad to read your text messages. But also you can slot in your contribution comment on our Facebook page, just in the comment section, and we'll be so glad to read your input in today's program. Doc, having laid a foundation and having known really that addiction is not anything that we should celebrate about, even as we are discussing it now, what are the underlying factors that lead, or causes that lead to addiction?
You know, addiction has been studied very widely, and even from practice, addiction unfortunately can be caused by so many things.
Right.
But in a nutshell, I would say people that have gone through so much are often the people who tend to become addicted.
Depression.
Or to begin misusing things. Okay? So what is this lot that people have gone through? Issues of unemployment. Unemployment can lead to abuse to addiction. Remember the root I said, use, abuse, then addiction. So unemployment can cause that. Adverse life, events, like losing a loved one, can lead to abuse of anything. The idea normally is when we go through something that is tough in life, we are often not taught how to handle these situations. There is no class in school to teach somebody how to handle disappointment. Imagine, and yet everybody has been disappointed before, including the lecture.
Yeah.
You don't learn how to handle social disappointment or failed relationships, failed marriages. You don't learn how to handle failure in terms of academic failure, business failure. You don't learn how to handle disease. If you are sick, how do you handle that? We don't learn that. We don't learn how to handle rejection. If you are rejected, how do you handle that? So oftentimes, because we do not know how to handle these adverse reactions, when we go through them, then we begin to feel bad. We want to find what will make us feel good. And that is how we begin to drive ourselves either to, to sex, because there's sex addiction.
Yes.
That is how we drive ourselves to drug, substance abuse and addiction. That is how we drive ourselves to social media. All of these are somehow compensatory mechanisms to try and deal with the void that exists within after one has gone through things like that. So it is much of these things. And by the way, not only the disappointment, sometimes it is even the stresses of life. Okay? Like work. If work is over stressful, it is one of the leading causes of addiction and substance abuse and all these other addictions. Okay? So you are being overworked at work, or you are being abused. Abuse is one of them. Children being raised in broken homes. Okay? Children being raised in broken homes. Children being raised in authoritative homes. So the style of parenting can determine whether somebody will end up into substance abuse and ultimately addiction. So it's a multifaceted thing, but that's why in summary, I just wanted to say people that have gone through a lot stand at a high chance of abusing stuff and ending up in addiction.
But can there be anyone that would just begin to move from use, abuse, and then eventually addiction out of nowhere? Maybe peer pressure or any other aspects?
Yes, remember, especially for the drugs that are abused have addictive properties.
Okay.
So it means when you use them, if you take, for example, an overdose, a dose that is more than the dose you're supposed to take, then you may begin to experience addictive properties of that drug. Okay. And in the end, you might find yourself abusing it. This is one of the things we see, for example, in cancer patients. I'll give us an example, right? So cancer patients, unfortunately, they often experience a lot of pain. Okay, not every cancer, but some of the cancers, people experience excruciating pain. So we put them on very strong painkillers. And these very strong painkillers have addictive properties. Okay, there are a number of them. Sometimes we fail to mention certain things on television, because when we mention them, it's a fine line between education and being what we call triggers,
yes,
right?
Yes.
Because for some of the people that are undergoing recovery, when you mention certain things, it becomes a trigger actually for that person who is watching to go and try. Indeed. So I may not mention the names of some of these drugs, but I would say cancer patients, we put them on strong painkillers. Those painkillers have an advantage of subsiding the pain, but they have the disadvantage of causing addiction. So you can find that this is a person who has gone for treatment at the hospital, but ends up as an addict on the other side. Peer pressure, which you have said, is very real. By the way, a good chunk of people that are in addiction, especially drug addiction and abuse, this started with peer pressure. Seeing a friend use a drug and a friend suggesting to use a drug. Yeah? And I'll say one of the strong cases of addiction is alcohol. Alcohol is drug number one that is heavily abused. Okay? Of course, if we open it loosely, it will go beyond alcohol to caffeine, which is in tea. But if you remove caffeine, which is in tea, you come to alcohol. Heavily abused.
No, but we have seen people that are addicted to tea. I have roots from the other side of the Zambezi, where tea is more or less like a must. There is nothing that they can do. They wouldn't function without tea. And when I'm looking at that, I'm saying, well, it's okay because it doesn't affect anyone. They don't become physically violent and all that. So it's a very good thing. But now that you are mentioning it, the effects of caffeine.
Yes.
And look, I'm here. If you talk about tea, I would take what I would call tea, whether there are tea leaves in it or I don't have a problem. But I know of a number of people that without tea leaves in their tea, then it's not tea.
That's very true. Of course, in our African Zambian context, we have gotten to call every hot water with some sugar in it as tea.
That's how I call it.
But you know, when we talk about tea itself as the plant, tea contains caffeine. There are a few other plants that actually contain caffeine. What is caffeine? If I was to go to the medical sciences, caffeine is what we call a xanthine. Under it, it's a family of drugs. We have caffeine, we have theophylline, and many others. What does caffeine do? Is tea a bad thing? Well, maybe not really, but if you get to the level of addiction, it's a bad thing. And here it is. So, tea and its counterparts, which are the xanthines in that family, they cause one thing from the health point of view, which is, we call them the smooth muscle reluctance. So what they do is they relax muscles. In your body, you have three major types of muscles. You have what we call skeletal muscles, okay? And within let me just put the skeletal muscles. You have what we call also the cardiac tissue or muscles, and you have what we call smooth muscles. The skeletal muscles are the ones we are using right now. When I'm speaking and moving like this, I'm using my skeletal muscles. The cardiac muscles sit in the heart. They are the ones that are causing the heart to pump, to beat. We have what we call the smooth muscles. These are the ones that make your blood vessels, your arteries, your veins. They're the ones that make your a good chunk of your respiratory system. They make your digestive system. For food to move in your digestive system, you need the smooth muscles to be contracting, releasing, contracting, and food moves that way. Okay. Now here's where I'm bringing this. Your stomach has two doors, one that closes on top and one that closes down. The one that closes on top is called the cardiac sphincter. The one that closes down is called the pyloric sphincter. The function of these doors is that when food enters in the stomach, they close. Close up, close down. Stomach work. What should the stomach do? Digest your food. When the food has been digested, the door down there opens. Food goes out. Now, the environment in the stomach is acidic, very acidic. For those that have done science, they'll know there's an acid there which is like hydrochloric acid at a very strong pH of 2 to 3. That's very strong. It's corrosive. But God has created your stomach in that it can contain that acid. Now remember, there's a door up, a door down. Why? The environment immediately above your stomach is not acidic, it's alkaline. The environment immediately below your stomach is not acidic, it's alkaline. And immediately you change the environment up or down, you cause problems. Now, where does tea come in? You have often observed that when you take tea or you take things like beans for certain people, you begin to have heartburns. So some people will say, I'm having heartburn. What is that heartburn? The heartburn is that the door on top of your stomach, the cardiac sphincter, has opened, and the food, as the stomach squeezes the food to digest, the food comes back. We call it esophageal reflux. The food comes back, the acid runs in your food pipe, which is the esophagus, corroding it. Then you get the burning pain in your chest, and you say, I have a heartburn. Now, that is not bad if it happens once in a while. But that is bad if it happens over and over, because you will then develop a condition which we call GERD, gastroesophageal reflux disease, which causes your food pipe, which is made of smooth muscles, for the muscles to lose their elasticity, and it begins to become a problem for you to swallow food. You may even end up with what we call strictures, which is called achalasia. So you may end up with food failing to pass in there. As food begins to get stuck in there, bacterial decomposition in there begins to corrode your food pipe, you may even end up with either a perforation or end up with what we call esophageal varices, where you find yourself bleeding and vomiting blood. This can happen. It does not happen in a week, but it can happen over time of using things that cause esophageal reflux. That is partly why we should avoid foodstuffs that contain caffeine. It's because in the long run, these are some of the things that can happen. But secondly, caffeine is also a stimulant. It has an effect on the brain. In your brain, you have these special cells that sit in there that are called neurons. The danger about neurons is that they are non-regenerative. Once they are damaged to a certain degree, they don't generate. They are gone. And that's why as we keep growing, we lose much of them. We end up later on with what we call neurodegenerative disorders like Parkinsonism, Alzheimer's disease, dementia. All of these come because your brain power is depleting. You are aging, the neurons are dying. Now, when you take things like caffeine and other things, by the way, in addictions, I should also talk about energy drinks, because energy drinks are rich in caffeine and other things in there. They end up in the long run damaging your brain. They have this fun effect. When you take them, you feel high and feel very alert and feel very sharp because they are stimulants. But they're damaging your brain. Over time, you begin to lose things like your memory. There is compromise in your memory, compromise in your intellectual capacity, and things like that. So that is why caffeine ultimately is not good. I have a recommendation though.
Okay.
Because often when we talk about these things, people say, but you are stopping us. But what now should we take?
We do?
Right?
Yeah.
If you want to be drinking tea, go and buy ribose tea. Ribose tea is not tea in itself. Ribose tea is a little syrup that commonly grows in South Africa. It is actually not tea.
Okay.
Okay? It does not have caffeine in it. But it comes with an advantage. Ribose is rich in what we call antioxidants. Antioxidants are molecules that are found in certain foods that actually scavenge in the body, removing dangerous things that are produced in your body that we call free radicals. As you are digesting food in your body and breaking down food in your body sometimes releases what are called free radicals. These things can cause cancer. Ribose tea, lemons are rich in antioxidants because vitamin C is also an antioxidant, and they are able to mop out all these free radicals in your body, reducing your chances of having cancer, increasing your lifespan, increasing your looks. You end up looking young and things like that.
Right, that sounds interesting. Big medical terms there that are coming, but I understand that sometimes we can't even. What is important is the information that has been given and all that. When we would have finally offloaded the dangers of addiction and why we should avoid that,
Yes.
one is left with no option but to ask really, what are the very, very effective strategies to recover from addiction?
Okay. And that's very important, my pastor, because many people are struggling with addiction. And as people struggle with addiction, they don't know what to do.
Sure.
Okay? Here's the thing. Maybe let's understand what addiction does to a person.
Okay.
Because then it will inform the issues of recovery.
Okay.
What causes addiction? Anything that causes addiction works on one underlying mechanism. In our brain releases a number of things that I'm going to call chemicals, okay? But in medical terms, we call them neurotransmitters, okay? One of them is a strong chemical called dopamine, okay? To our viewers, I hope you can remember this word, dopamine. That's the good thing about Hope TV. You know, by the time you're done with whatever is happening, also education is happening.
Indeed.
Yes. So to our viewers, dopamine. Dopamine is the chemical that makes us to feel good. There are many chemicals that make us to feel good, but top on that range is dopamine. When you eat good
underlined
food,
the word.
yes, when you eat good food, how you feel, it's dopamine. Your best of food, dopamine. When people have sex, the feeling they get is dopamine. So why did God give us dopamine? He gave us dopamine to sustain us as a species. Because two things sustain us. It is sex and food. Sex allows us to multiply, have another generation and have another generation. If there was no dopamine, we would not be interested in sex. We would be bypassing each other as brothers and sisters without anybody caring.
Brothers and sisters.
The challenge of that is that we would go extinct. So God has put this chemical where when people engage in sex, they feel good, therefore they would want to come back and have sex again.
So it's a bet.
Yes, it's a bet.
They are trapped in there.
Yes. And so that is why, you know, the hardest thing that can happen also is for somebody that has been introduced to sex to be told to stop.
Yeah.
And perhaps that's why God tells us to avoid before marriage, because immediately young people engage in sex before marriage. It is almost an immediate addiction. It's the dopamine reward system. So sex, dopamine, food, dopamine, because we need to eat, otherwise you will die. Now here is the challenge. When you engage yourself in things like drug abuse, when you take a drug like cocaine, alcohol and what, they also go and engage in a release of dopamine. The only problem is they lead to an over 20 times the release of dopamine as that which you'd get from sex or from food.
Because it's natural.
Yes.
So those are not really natural, and so they hammer.
Exactly. So the question I would want to ask is this. If we told you to stop eating your favorite food, Pastor, how easy is that?
Wow.
What's your favorite food?
I'm still trying to restructure that, but I would go for anything that is with, you know, mavisi.
I thought so.
Yeah, we are seriously addicted to
Mavis.
Mavis.
Now imagine if somebody came
and that's why we are in the church. When we found Mavis, then we said, this is home.
Now you imagine, my pastor, somebody comes and says, completely stop taking Mavis. It will not be easy.
No, it will be war.
Yes, because the battle is against the good feeling of dopamine. So that is how we can't move to somebody who is addicted to alcohol and say stop. They can't stop. That's how you can't move to somebody who is addicted to cocaine and say stop. By the way, addiction cannot be stopped just by good advice. So when somebody has reached the level of addiction, you don't call the elders to say, advise him about life and what will happen to his life if he doesn't change. That person will listen to your advice, and he means well. He has good intentions to stop, but he can't stop. Why? At that level, body physiology is also involved with the release of dopamine. Okay? So what does this mean, therefore? When a person has reached addiction, they need medical intervention.
Okay.
So the approach should be three in what I'm going to suggest. Number one, they need medical intervention, which will involve medical admission of medicines, which will also involve what we call psychotherapy, okay? Which should be done by a trained professional, okay? Away from that, from the hospital, we end normally with these two, which is psychotherapy, which has a lot of things within there, and also, you know, therapeutical interventions by giving medicines, which again has a lot of things in there. But when I come to the spiritual side of things, you also need spiritual intervention and sociological intervention. So if I'm to make this very clear, you need prayers. Why?
Oh, yeah.
God needs to come in. He's the mastermind who understands how the mind works. And also it is because away from what science has discovered, I believe that if God wants to intervene miraculously, he can. But this happens in very rare cases. In most cases, God does not intervene with miracles where he has revealed medical knowledge that can assist you.
Okay.
Okay? So on one side, let this person pray. Let the people around the person pray. That is spiritual intervention. Sociological intervention. Remember, every person who is abusing anything, they have a social support system that supports that vice. Any person who smokes has a group they smoke with.
Oh, yeah.
It is rare to find a person who smokes weed alone.
Yeah,
It's rare to find somebody who drinks alone. So you need sociological intervention. What does that mean? Now, in the rehab center where I also, you know, offer consultancy, I tell them that the strongest strategy to breaking away from addiction is changing your friends. You literally, even if we did all these things, as long as the person who is addicted does not change their circle of friends, they will relapse. Because it is within the circle of friends that you have people to supply you. So that is another strategy, change your friendship. Then seek medical intervention, talk to a health practitioner, a doctor, a nurse, a pharmacist, a physiotherapist. These people are trained to actually assist. And I should mention, my pastor, that that is to the person who has an addiction. But there are people who have an addiction who are not willing to go through this process. But the addiction begins to affect the people around them.
Okay.
Maybe people also must get to learn how to tell that somebody is addicted.
Okay. Okay.
Yes.
So it's a lot of work really that does not just involve one person. It's everyone has to be involved, has to be concerned. As we near the end of this particular discussion, Doc,
Yes.
I want you to address the issue of stigma,
Yes.
as well as the shame feeling. So everyone now knows that I am an addict. How do I respond? Or how should other people treat an addict of anything?
And that's a very fundamental conversation, my pastor. Stigma is one of the reasons that causes many people to relapse, former addicts.
Okay.
Okay? And unfortunately, what I've come to realize here on earth is that we are often, all of us, struggling with something.
Indeed.
We are very kind to ourselves on what we are struggling with, and very unkind to others with what they are struggling with.
That's our nature.
Yes,
Yeah.
that's the unfortunate thing. So I should mention, number one, to everybody who is following here, know that everyone is a potential addict, including yourself. Some of you are just not addict because you have not yet experienced the life.
Yeah.
Either you have not had chance or you have not suffered real stuff in this life. I've seen people who were church elders until their wife divorced them and the elder went to a bar.
Yeah, they are more friendly than at church.
Yes. You know?
Yeah.
So because this person now at church where he is, people are ever talking about his failed marriage and everything. So when he comes to church, he literally feels that he's judged in that space.
Yeah, so I have
Already
to
is
spend time.
dealing with his divorce. But we are social beings.
Right.
Then he arrives at the bar. Nobody talks about the
They're
divorce.
actually handing over the bottle.
Yes,
and
and he feels very, very well.
dopamine.
And the dopamine issues.
Yeah.
So let us avoid stigmatizing any person who is struggling with anything. By the way, if a former addict, a person who has come out of addiction, if there is anything they need, it's social support. Remember, they need to change friends. Now, if you that call yourselves good can't accept them, where do you expect them to go? They'll go back to the same grouping. So you need to accept them to come in. The thing that a former addict craves the most is trust. Because any addiction breaks trust. Any person who was addicted, trust is broken between them and the husband, them and siblings, them and the employer. An employer can't trust somebody who is an alcoholic.
Yeah.
So when the person changes, what you want to gift them with is a second chance and to show that you can trust them. Okay? To begin engaging them in activities that can build actually trust.
All right. And I'm loving that one because if we zero in from a biblical perspective, we now realize that God is love and He does forgive. And so if God is able to demonstrate His love towards one that was erring and shows the forgiveness that is needed,
Yes.
then as society we have no reason to really push back somebody, especially who are on their journey to redemption. And that's the whole idea why we are discussing this particular topic today. Now, as we really conclude this segment, before I ask you about the reason why you are wearing that t-shirt, just so we as Christians, I love the example that you gave where a member of the church is not necessarily an elder.
Yeah, it can be anybody.
I was talking to somebody yesterday in the northern part of this country who said there is one congregation in a small village, really, where members of the church, to a larger extent, during the course of the week, they meet in bars and they're drinking and all that. But they come on the day of worship and they are, you know, aligning themselves. But they know each other and all that. So it is a serious issue, not just for the world out there, but it's also a serious issue within our congregation. How should we respond to issues of addiction in the church? Under just a minute before we talk about the next.
I actually think let us establish counseling departments in the church. We don't have a counseling department in the church. I don't know whether your local church does, but my local church does not have. So anybody who is in the church, and you know, we normally just tell people to say, well, if you have issues, maybe go and see the elders. Well, I don't think our elders are trained in counseling.
Okay.
So somebody can't just go to the elder because the elder is an elder. Their fear is, tomorrow I'll hear my issue all over, right?
To be trending.
The pastors I know are trained in counseling,
Indeed.
but we have this notion that the pastor is holy. And if you're going to go and tell him your issues, sometimes people fear to hear, you know, in a sermon somewhere to say, you know, there's this brother I once counseled. Let's establish, I like, when HIV came as a pandemic and hit the church very hard, I think you remember, my pastor, that our churches established counseling centers within the churches.
Yes, yes.
But those, after HIV became a normal thing and everything, they died down. Let's establish counseling departments in our church. We can have some professionals, health professionals, who can work there pro bono on free.
Okay.
I believe so, because as professionals, we are under oath to do that. But also the church, either the pastor can have a day that he sits in, or even just the pastor. Let there be an announcement. Pastor saying, every Wednesday from 14 to 17, I'm in office. Any person struggling with issues of addiction, you can come through. We have a chat.
Now, I'll tell you this, that there is one course that we, that theologians take. It's called Pastoral Counseling and Psychology.
Yes.
Now, when that was introduced at the time that I was taking the course, what quickly came onto my mind was we needed to establish a moment where people would come and see the pastor for any of their issues, because you know we have guidelines, issues of confidentiality and all that put in place. And guess what? When we opened up that, it wasn't for a long time. People came in large numbers, and I said, well, had it not been that I'm doing this for the purposes of education, we probably just need to establish this forever so that it keeps running and running. But you know, there are other issues that we are dealing. But like you are suggesting, a pastor dedicates time at least once a week. It will still,
Even just that would help
it
very
will still
much.
help. Even, okay, let's say once a month for a start, and then it will help us in that way. Okay, Hope Live is what you are watching, and we are just discussing the issues of addiction. Overcoming addiction is what we are interested in, and we pray that after this discussion, well, it might not be just instant, but as we keep learning, as we keep doing, Dr. Kabani is here, many other people are here that we can talk to, and that's the reason why we are inviting your text messages. At a later stage, we are going to read the messages, but let's talk about the next 24 National Education Expo. Very interesting. I've been seeing it for some time now, flying, and at some point I said I must gather my family together for this expo, but let me get to know what this is all about. What is
That
it?
would be great. Well, Pastor, the National Education Expo is an initiative
Okay.
that is created to create education opportunities,
Okay.
empowerment, and education within our population as Zambia to foster two things:
All right.
personal development and national development.
Wow.
So we are using education as a driver of personal development and national development. If you look at any developed country, by the way, when countries are gauged in terms of development, one of the things that is used as a marker, as a parameter, is education in the Human Development Index. That is an index that is used to judge how developed countries are. Education.
Right.
Educated societies There are a number of things that have been seen. Mortality is low in terms of people dying, mothers dying, nutrition is good, and everything else. So we are creating a platform where 2,500 people are going to come and meet at Mulungushi International Conference Center on the 13th of October. We are bringing in 3 international speakers.
So soon.
Yes, 3 international speakers, 1 from the US, 1 from Kenya, 1 from South Africa. And we have our local speakers, about 12 of them. These are different men and women, gifted and competent in their different disciplines. So what are we going to talk about? We're going to talk about business, entrepreneurship, and financial literacy.
Okay.
We're going to talk about education and career development. We're going to talk about personal development and personal branding. Then we're going to talk about innovation and research. It is open to every person, the young, the old, beginning especially those that are in high school going forward, because we are going to talk about professional development and personal development. So this is the National Education Expo. We had the last one in 2021. And we had 1,500 people in attendance, and I think many lives were changed. I encourage people to be around.
Well, we just have to do that, but somebody is asking what really motivated you to think of this initiative?
You know, my pastor, for me, I'll tell you that education is evident in what it has done for us as a family.
Okay.
I'm passionate about education because I normally tell people, I was born in a very rural setting. In modern day Shangobo district, Osioma, we have a mission post called Stoti.
Yes.
That's where
I've been there.
Yes, that's where I was born from. Maybe now it looks developed.
I was at your village. Just for your information, I've been to your village.
My pastor, the time I was born there were just about 5 houses made of brick, 1 church, a little clinic surrounded by villagers. Mom and dad teaching there is primary school teachers. These 2 people with their certificate in education continued to upgrade themselves. By the time they were retiring, my dad was a DESO, my mom was a DAO. Our lives had changed. Why you see me where I am, and I know you as a friend, you know my other siblings. I think they are all doing fine for themselves.
Indeed.
By God's grace, what has brought us to here is education. What it has done for me is what I would want to see it doing for every other person that is disadvantaged.
All right, everyone has to be at Mulungushi on the 13th of October, but then how?
Okay, so, you know, because these events are quite costly.
Okay.
You know, my pastor, people would be shocked to know that just hiring Mulungushi is 80,000 kwacha.
Yeah.
Tickets flying in, these people that are speaking to us and everything in that line. So we normally ask our delegates to also help us meet the cost of running this event.
Okay.
So there are tickets to that. Ordinary tickets are 200 kwacha. Then tickets for all the people that are still in school, either as pupils or as students.
Students.
Except you, my pastor. I saw that one. For
No,
students,
I am a student. When is a student.
you and when are excluded.
Oh, shit.
So it's 150 kwacha
Okay.
for the students. And I think for Hope Channel Zambia, we love what you're doing here.
Okay.
So I think we'll support the team at Hope Channel Zambia.
Indeed.
I would have asked, but of course that's a secret how many people are working here.
Okay.
But I think we will give 10 free tickets to support Hope Channel Zambia here. Yeah.
You've seen the jubilation around here, so it means people are excited, and we look forward to being a part of this initiative, and we'll keep talking. I know it's not the end. This is just the beginning, but we look forward to having you yet again on this program and many other platforms that Hope Channel is offering as we keep working together with the community. Thank you so much for coming.
So the tickets, they can get them from ShopRite. CompuTicket anywhere across Zambia, or they can check our Facebook page, DNK General Consultants, or my page, Dr. Daniel Kabani. You can either buy directly from our office or from ShopRite.
All right, there you have it. You have no reason to miss this important event, because it's about you and the community around you, and all is going to be well. Testimonies are there from the previous one. How about you become part of the people to testify about what you're going to experience there? All right, we go to the very last part as we discuss the issues surrounding the budget. Mwene will be joining me on the other side as we conclude. Dr. Kabani, thank you so much for coming
Thank you,
through.
my pastor.
Right.
Thank you so much.